Hello, good day everyone. I'm Shaikha Alkhalifa and I have over 10 years experience in the healthcare. I've worked in a public hospital and a private hospital. And since monetization is a hot topic in the recent years, I chose monetization in public healthcare systems, a semi-systematic review of fiscal, digital, and governance dimensions. So this paper looks at monetization reforms in public healthcare systems. Over the last decades, governments have increasingly introduced financial valuation, performance incentives, and data-driven value creation into healthcare delivery. While these reforms are often justified as technical or fiscal solutions or tools, this paper argues that monetization should not be seen as a financial tool. Instead, it should be a governance transformation. Using a semi-systematic literature review covering the period of 2014 to 2024, I synthesized evidence across fiscal, digital, and institutional literatures and understanding how monetization impacts healthcare systems. Public healthcare systems worldwide are facing intensifying pressure, aging populations, growing burden of chronic disease, and rapidly rising technologies and increased treatment costs. And on the other hand, from a citizen's perspective, citizens are expecting higher quality public and private healthcare services, and as well, they expect more responsive care. In response, governments have turned to monetization reforms to improve efficiency, transparency, and fiscal sustainability. However, despite the growing use of these reforms, academic evidence remains fragmented as we speak, and often narrowly focused on cost efficiency. This creates uncertainty in this field about their broader implications for equity, governance, and long-term service quality, which mainly motivates this review. To address these gaps, this review is guided by three main research questions. First, how is healthcare monetization conceptualized across health economics, public administration, and digital governance? The second question, what evidence exists currently on its effects on fiscal performance, service quality, and equity? And finally, the third, how do emerging digital and data-driven monetization models reshape governance dynamics, accountability mechanisms, and public trust within healthcare systems? The methodology used. Methodologically, the study adopts a semi-systematic literature review, following Snyder's integrated framework. This approach is particularly suited to fragmented and interdisciplinary fields. The review draws on two major databases, Business Source Premier and ABI Inform Global. The search was limited to peer-reviewed journal articles published between 2014 to 2024. In total, 78 articles were screened and 41 studies met the inclusion criteria and were retained for analysis. The analytical approach. Rather than aggregating effect sizes, the analysis focuses on thematic synthesis. Each study was coded according to the monetization mechanisms examined, theoretical frameworks used, and the methodological approach adopted. This allowed for comparative analysis across fiscal, governance, digital, and institutional perspectives. The aim was to identify dominant patterns, recurring tensions, and governance implications rather than to produce a single quantitative estimate of impact. The review identifies 6 dominant research streams: fiscal and efficiency-oriented monetization, governance, equity, and public value perspectives, digital and data monetization, behavioral and outcome-based monetization, environmental and social health valuation, political economy, and institutional implementation. Each stream emphasizes different objectives and metrics, which helps explain why the literature often reaches contrasting conclusions about the desirability of monetization reforms. Key findings. Across these streams, 3 cross-cutting findings emerge. First, monetization reforms often improve financial transparency and short-term efficiency. Second, these gains are frequently accompanied by equity trade-offs, service stratification, and institutional tensions, particularly affecting vulnerable populations. Third, digital and data-driven monetization introduces new opportunities for value creation, but also raises significant governance, privacy, and trust concerns. Importantly, outcomes are highly concept-dependent and strongly shaped by institutional capacity and regulatory design. So where does this field need to go? The review also points to clear directions for future research. There is a strong need for integrated evaluation frameworks that combine efficiency, equity, and public value metrics. More longitudinal and mixed method studies are required, particularly in low and middle income contexts. Empirical evidence on digital health data monetization remains limited so far, and greater attention is needed on governance, ethics, and public trust in increasingly data-driven healthcare systems. So what does this paper contribute? What does this paper add? Conceptually, it reframes healthcare monetization as a governance reform rather than a purely fiscal or financial instrument. Empirically, it integrates fragmented literature that are rarely examined together. Methodologically, it demonstrates the value of semi-systematic reviews for interdisciplinary fields. Finally, it highlights the institutional capacity as a key factor shaping whether monetization produces efficiency gains or exacerbates inequities. In conclusion, healthcare monetization is not a neutral technical intervention. It reshapes incentives, organizational behavior, and defines public value. While monetization can enhance fiscal sustainability and efficiency, these benefits are not automatic and depend heavily on governance design and institutional capacity, which puts institutions at governance risk. The central takeaway is that monetization reforms must be treated as governance challenges rather than purely financial solutions, if they are to support equitable and sustainable healthcare systems. In short, monetization works best when public value, not just price, remains at the center of healthcare governance. Thank you for your time.